What is blood in stool, poo? You might see blood in your stool, poo, after using the toilet.
You may also see spots of blood on the toilet paper or drops of blood in the toilet bowl. A small amount of bleeding one time is usually not serious. But blood in your stool can indicate a range of problems, some of which are very serious. So, it's best to get a doctor to check. Blood in your stool can be bright red, dark red or black. The color of the blood depends on where the blood is coming from.
Spots of red blood indicate the bleeding is coming from your large intestine or rectum. If the blood is dark red and mixed in with your poo, it may be from higher up in your bowel, such as your colon or small intestine. If your stools are black like tar, and smell bad, the blood is probably coming from higher up in your gastrointestinal tract.
Blood in your stool can be caused by many different things. These can include
anal fissures, which are small painful cracks in the anus. Hemorrhoids.
1. Gastroenteritis, tummy bug. 2. Diverticular disease. 3.
Inflammatory bowel disease, Crohn's disease or ulcerative colitis. 4. Polyps, an early sign of bowel cancer. Sometimes poo can look like it's mixed with blood after you've eaten a lot of red or purple foods. Foods like tomatoes and beetroot can cause this to happen.
Very dark or black blood, or poo can be caused by 1. Bleeding in your stomach. 2.
Stomach ulcer.
3.
Side effects of medicines such as warfarin. Sometimes your poo can look very dark or black if you
1. Take iron tablets. 2.
Eat a lot of dark foods like licorice and blueberries. How is the cause of blood in stools diagnosed?
Your doctor will talk with you about your symptoms. They will also examine you, and may arrange some tests to investigate the cause.
Your doctor will choose the right test for you based on your age, symptoms and medical history.
Possible tests include 1. Rectal examination, your doctor checks your bottom with a gloved finger. 2. Blood tests. 3. Stool tests.
Your doctor may also refer you to a specialist for further tests, such as a
1.
Sigmoidoscopy, a flexible tube with a camera on the end is used to check inside your rectum and your lower large intestine, sigmoid colon.
2.
Colonoscopy, a flexible tube with a camera on the end is used to examine your entire colon.
3.
Gastroscopy, an endoscope, flexible tube with a camera on the end, is used to look at your esophagus, food pipe, stomach and first part of your small intestine.
Some of these tests are done under sedation. You may need to go to hospital. Ask your doctor for more information.
When should I see a doctor? Ask for an urgent doctor's appointment if
1. Your poo is dark red or black. 2. You have bloody diarrhea.
If you have blood in your poo for 3 weeks, make sure you get it checked out by a doctor.
You should also see your doctor if you 1. Have a change in how often you poo or the texture of your poo. 2. Have abdominal pain. 3. Feel very tired or weak. Blood in your stool is sometimes a sign of bowel cancer. This is easier to treat if it's found early. Always see your doctor if you have blood in your stools, even if you've had a known cause in the past.
If you have blood in your stool and you feel faint, dizzy or lightheaded, this may be an emergency. Go to the nearest emergency department as soon as possible or call 000 and ask for an ambulance.
When to seek urgent care. Go to the emergency department if you are 1. Bleeding non-stop. 2. There's a lot of blood, the toilet water is red and there are large blood clots. It's important to find the cause of the blood in your stools because that will determine the treatment you need. Self-care at home.
Some causes of bleeding such as hemorrhoids or anal fissure may be treated by changes to your lifestyle or diet.
Medicines for blood in stools.
It's also a good idea to have your doctor or pharmacist review your medicines if you have blood in your stools or dark stools.
Always see your doctor if you have blood in your stools, even if you've had a known cause in the past.
Can blood in stools be prevented?
There are some things you can do to help prevent some causes of blood in your stool. It's a good idea to 1. Drink plenty of water. 2.
Eat a healthy and varied diet.
3.
Keep active. 4.
Go to the toilet when you need to and avoid straining.
It's important to have screening tests for bowel cancer. Bowel cancer screening tests are sent to all Australians aged between 50 and 74 years.